Welcome to Chapter 15, the Endocrine System. This system course objectives for this chapter are to locate the main structures in the endocrine system, discuss the anatomy and physiology, understand the word parts and common medical terminology, and for you to define the abbreviations used in the endocrine system. So the functions of the endocrine system are to produce hormones, store hormones, and release hormones into the blood. We know that the functions of hormones are used by other organs to control and coordinate metabolism, reproduction, growth, and development. When we start with the anatomy and physiology and the organ structures, the endocrine glands are important because they are the ductless glands that secrete hormones directly into the bloodstream. These glands include the adrenal glands, the islets of Langerhans, the ovaries, the parathyroid glands, the pineal gland, the pituitary gland, the testes, the thymus gland, and the thyroid gland. Here we can see the glands of the endocrine system in a male and female. You see the pineal glands, the pituitary gland, the parathyroid glands, and the thyroid gland, the thymus gland, the adrenal glands, and the testes and ovaries in male and female. The pituitary gland is a pea-sized gland located at the base of the brain. It consists of two lobes, the anterior and posterior. The hypothalamus controls release of hormone from this gland. In the pituitary gland, the anterior lobe, the adrenocorticotropic hormone, ACTH hormone, stimulates the adrenal cortex. Additionally, in the anterior lobe, FSH, or the follicle-stimulating hormone, regulates the ovaries and the testicles, and it stimulates secretion of estrogen in females and sperm production in males. Growth hormone, or GH, regulates the body's growth. The luteinizing hormone, or LH, stimulates secretion of progesterone in females and testosterone in males. Prolactin stimulates milk production. TSH, or the thyroid stimulating hormone, stimulates the thyroid gland. ADH is antidiuretic hormone, and that stimulates water absorption by the kidneys. Oxytocin stimulates uterine contractions. The pineal gland is the small cone-shaped gland located in the brain. Melatonin affects sleep-wake cycles and reproduction. The thyroid gland is a gland with two lobes, and it's located below the larynx, and it is the largest endocrine gland. T4, or thyroxine, regulates metabolism, and T3, triiodothyronine, regulates metabolism as well. Here's a diagram of the thyroid gland and adjacent structures, so you can see the thyroid cartilage, the actual thyroid gland wrapping around the trachea there, the superior parathyroids, the inferior parathyroids, the isthmus there as well. The parathyroid glands are four small glands located behind the thyroid, and parathyroid hormone, or PTH, regulates calcium and phosphorus levels in the blood and bones. The islets of Langerhans are the endocrine cells inside the pancreas, and we know that insulin regulates blood glucose levels, and that's done in the pancreas. And the thymus gland is the gland located in the mediastinum. Thymosin regulates immune responses. The adrenal glands are the pair of glands located on top of the kidneys, and each gland consists of the adrenal cortex and the adrenal medulla. And the adrenal cortex is the outer portion of the gland. Aldosterone is that hormone that regulates electrolyte levels, and cortisol is the hormone that aids in metabolism and also aids in the body during stress. Additionally, in the adrenal medulla, the inner portion of the gland, that's where epinephrine and norepinephrine are secreted, and they aid the body during stress by raising heart rate, blood pressure, and respiration. The ovaries are the female reproductive glands attached to the uterus, and that's where the hormones estrogen and progesterone that affect the development of female sex organs and secondary sexual characteristics, and they're involved in regulation of the menstrual cycle and pregnancy as well. The testes are the male reproductive glands located in the scrotum, and that's where the hormone testosterone is located and affects the development of sexual organs in males and secondary sexual characteristics. Word parts in this system are acro for extremity or tip, adeno for gland, adrenal or adrenalo for adrenal glands, calci for calcium, cortico for cortex, crino to secrete, dipso for thirst, endocrino for endocrine, gluco or glucoso, glyco and glycoso for glucose or sugar, hormono for hormone, kali for potassium, natri for sodium, pancreato for pancreas, parathyroid for parathyroid glands, and thymo for the thymus gland, thyroid, thyro or thyroido for thyroid gland, U for prefixes, U for good or normal, hyper above excess, hypo below deficient, poly for many or much. Suffixes are al or ic for pertaining to, ism for condition of, megaly for enlargement, oid for resembling, osis for abnormal condition, penia for deficiency. Some adjectives and other related terms to this system are endogenous for produced inside the body, euthyroid for a normal thyroid, exogenous for produced outside of the body, metabolism, referring to all the physical and chemical changes that occur in tissue. Adenalagia is the pain in a gland. Adenitis is the inflammation of a gland. Adenomegaly is the enlargement of a gland. Endocrinopathy is the disease of an endocrine gland. Terms related to the pituitary gland include acromegaly, and that's the enlargement of the extremities caused by excessive production of growth hormone. Diabetes insipidus, or DI, is the disorder caused by the deficiency of an antidiuretic hormone produced by the pituitary gland, and that results in excessive urination and excessive thirst. Gigantism is a condition of excessive body growth caused by overproduction of growth hormone by a pituitary gland. And here we can see the comparison of a patient with a normal hand on the right and the patient with acromegaly on the left. Additional terms related to the thyroid gland include congenital hypothyroidism, and that's a condition caused by absence or the atrophy of the thyroid gland present at birth, and it can be characterized by mental deficiency and dwarfism, formerly known as cretinism. Goiter is the enlargement of the thyroid gland. Graves' disease is a condition of excessive secretion of thyroid hormone causing goiter and exophthalmos. Here we can see toxic goiter or Graves' disease, simple non-toxic goiter, and nodular goiter as well. Here is a patient with exophthalmos, and you can see the enlargement of the eyes there. Terms related to the thyroid gland: Hashimoto's thyroiditis, or Hashimoto's disease. That's an autoimmune disease causing chronic thyroiditis. Hyperthyroidism is excessive hormone production by the thyroid gland. Hypothyroidism is a deficient hormone production by the thyroid gland. Myxedemia is severe hypothyroidism in adult, and that's characterized by pale, dry skin, brittle hair, and sluggishness. Thyroiditis is the inflammation of the thyroid gland. Thyromegaly, the enlargement of the thyroid gland. Thyrotoxicosis is a condition of excessively high levels of thyroid hormone. Hyperparathyroidism is the excessive hormone production by the parathyroid glands. Hypoparathyroidism is a deficient hormone production by the parathyroid glands. Tetany are spasms of nerves and muscles due to low levels of calcium in the blood, and it's caused by the deficient production of parathyroid hormone. Terms related to the adrenal glands are Addison's disease, and that's caused by a deficiency of cortisol production by the adrenal glands. Adrenalitis is an inflammation of an adrenal gland. Adrenomegaly is the enlargement of an adrenal gland. Adrenopathy is a disease of the adrenal gland. Cushing syndrome is a disease caused by excessive cortisol production by the adrenal glands. Here you can see a patient with Cushing syndrome. Terms related to diabetes mellitus, or the Islets of Langerhans. DM is the abbreviation for diabetes mellitus, and that's a disorder caused by deficiency of insulin or insulin resistance. Type 1 diabetes mellitus is caused by a total lack of insulin production in the pancreas. Type 2 is diabetes caused by either a lack of insulin or the body's inability to use the insulin efficiently. DKA is diabetic ketoacidosis, and that's the excessive ketones in blood, and it's a buildup of excessive ketones in blood, and that's due to the breakdown of stored fats for energy, and it's a complication of diabetes mellitus, and if left untreated can lead to coma and death. Laboratory tests used to measure glucose are blood glucose or blood sugar, and that's the test to measure the amount of glucose in the blood. A fasting blood glucose test is a blood test that measures the amount of glucose in the blood after fasting for at least 8 hours. A glucometer is the device for measuring blood glucose levels from a drop of blood obtained by a finger stick. And here you can see a traditional or kind of old school glucometer, and the lancing device to poke the finger, the meter, the test strip to test the blood, the carrying case, and the lancets. Here is another type of glucometer, or like an insulin pump. This is a little bit more modern one. A laboratory test to measure glucose is another one is the GTT, the glucose tolerance test, and that's the blood test that measures the amount of glucose in the blood after administering a dose of glucose to the patient. You usually drink it, and it's used to gauge the body's ability to metabolize glucose. Glycosylated, sorry, I'm not sure why I can't say that. Dietitians deal with this all the time. Glycosylated hemoglobin test, and that indicates the amount of glucose in the blood over several months, and it's used to indicate how well diabetes mellitus is being controlled. Thyroid hormones. The thyroid function test is the blood test that measures thyroid hormone levels in the blood. The thyroxine level is the blood test that measures the amount of thyroxine in the blood to diagnose hyperthyroidism or hypothyroidism. Other laboratory tests associated with the system are an electrolyte panel, a blood test to measure the amount of sodium, potassium chloride, and carbon dioxide in the blood. And thyroid stimulating hormone, that's the blood test that measures the amount of thyroid stimulating hormone in the blood, and it's used to diagnose hyperthyroidism and to monitor thyroid replacement therapy. So we'll stop here and move on to the latter part of this section.